Why do we care about blood pressure? Blood pressure is the force of your blood against the walls of your arteries. Hypertension or high blood pressure is when this force is more than it should be. When blood pressure is high for an extended amount of time, it can cause problems like stroke and organ damage. One of the most important aspects of the program is taking your blood pressure correctly to ensure an accurate reading. Prior to going home from the hospital, one of our program's medical assistants will teach you how to correctly take your blood pressure. Your upper arm will be measured so we can send you home with the correct size of blood pressure cuff. Most recent national guidelines suggest that the most accurate way to take your blood pressure is at home in your own environment. If you are on blood pressure medications, please time your blood pressure reading to be about 60 to 90 minutes after your morning dose. We use this value to ensure correct dosing of your blood pressure medications, and we can increase or decrease your dosing based on this after medication value. In the 30 minutes before you take your blood pressure, do not exercise, eat a large meal, or use products containing caffeine or nicotine, such as coffee, tea, or cigarettes. Prior to sitting down to take your blood pressure, you should empty your bladder. Sit at a table, such as a dining room table, on a chair with your feet flat on the floor and your legs uncrossed. Place the blood pressure cuff on your left arm, as this arm is more accurate, unless otherwise instructed by the nurse. The cuff should be on your skin without any clothing between the cuff and your arm, and should be just above the bend of your elbow. It should be snug around your arm, but not too tight. Your arm should be rested on the table at about the level of your heart, with your palm facing up. Do not tense your arm or take your blood pressure while feeling anxious. Leave your arm relaxed and rested on the table, and make sure to rest for 5 to 10 minutes quietly prior to taking your blood pressure. Using your device, tap Vitals Now. Tap Select All so you include the daily questions and a blood pressure. Answer the listed questions and follow the prompts to start your blood pressure machine. The cuff should inflate and deflate to measure your blood pressure. Your environment should be quiet. Any noise can raise your blood pressure and can give an inaccurate value. Do not talk, text, or watch TV while taking your blood pressure. Take slow, deep breaths. On your device, make sure to follow the prompts until you reach the final screen to ensure the device reads Transmission Successful. Tap Done when complete. Tap Vitals Now, then tap Blood Pressure to complete your second blood pressure, and follow the prompts to take your second measurement. Cycle to the final screen to ensure transmission of your blood pressure by viewing Transmission Successful, and press Done. You can now take off your blood pressure cuff. To ensure accuracy, make sure to take 2 blood pressures during the same sitting, about 1 minute apart. You will be contacted by the telehealth nurse if your values are concerning, or you mark that you are having symptoms. When the blood pressure measurement is complete, you will see 3 numbers. The top value of your blood pressure is called systolic blood pressure, which is the pressure in your arteries when your heart beats. The bottom number of your blood pressure is called diastolic blood pressure, which is the pressure in your arteries when your heart is at rest. The third number is your heart's beats per minute. No news from the telehealth team means no action is necessary. If your measurements are concerning to the telehealth team, you can expect a call or text shortly to discuss your results and make a plan for treatment as needed. Continue to report any concerning signs or symptoms of preeclampsia, such as severe headache, seeing spots or other visual changes, shortness of breath, pain in the upper right side of your abdomen, feeling nauseous or throwing up, or swelling in your hands or face. If you are unable to take your blood pressure prior to 1 p.m. using these instructions, please discuss with the telehealth team. The telehealth nurses are available daily from 8 a.m. to 4 p.m. for any questions or concerns.